So when did you graduate at UCLA?
That was 1992, and then residency's 3 years, and so I finished in 1995. And then I got board certified in family practice and started to work in Santa Barbara in 1995.
Okay. And so you said you did some research on your own, and then what happened from there to now being the director of the Integrative Medicine Center?
As I was doing stuff on my own, I was learning really on my own. And that's kind of the way doctors have to do it if you want to learn healthcare, if you want to learn more about how to take care of people's health rather than just giving medications. You kind of are left on your own. But I found some organizations that were helpful, and I go to seminars and about nutritional medicine seminars, for example, and things like that. And then there was another doctor in Santa Barbara who was doing the same thing, and he had a lot of experience. He was doing chelation therapy, IV therapy, hyperbaric oxygen, things that I had dabbled in and knew a little bit about, but really hadn't practiced much. And he was sick, and he wanted to sell his practice. So I came and worked with him a little bit, and next thing I know, he died, and I was left with it. And so it was kind of like thrown into my lap. But was really good about it is all the things that I learned that I sort of had known a little bit about that I was really practicing now, was all of those modalities that I'd never learned in medical school or formal training.
So integrative medicine is basically taking several different modalities, putting them together, and basically finding the best solution on each person's individual basis, I would gather.
It's a good way to put it, whatever works. I always just tell people, they ask, what's integrative medicine? Whatever works. And so if it requires an herb, we do that. If it requires nutrient supplements, we do that. If people can't get their nutrients from their food, then we give it in their veins. We do whatever it takes to fix the problem. I'll give you an example. Recently, a woman came, a young woman, 23 years old, and she and her boyfriend came in. They're planning on getting married and having children, and she says, I'm tired all the time. And she went to her doctor, and her doctor put her on a medication for depression, which is a very common thing. People who are tired are often given antidepressants. And she said it didn't work, it didn't help. So we put her through a battery of tests, and tests that we never learned in medical school. We have to send them to North Carolina, to a specialty lab to get these tests done. Because they're not commonly done by doctors. And we found out that she has a deficiency of an enzyme. She can't use sugar for energy. So lactic acid builds up in her body, and she gets this terrible fatigue. So we, in doing some research then, we found out that we could put her on a special diet where she would only burn fat and not sugar. She wouldn't build up lactic acid, and she could live a normal life and have children and be normal, mostly normal. Like, so how normal can you be if you can never have sugar, right?
Yeah.
But aside from the diet, she would never be.
Wow.
Yeah. It's pretty good. So it's whatever works, whatever it takes. So in some cases, there are genetic problems. Other cases, I had a gentleman who was diagnosed with Alzheimer's disease, and he was given some drugs for Alzheimer's. And his wife brought him in here and said, they don't work. Don't you have anything like natural, anything that would work better? And I said, well, let's start from scratch. And so it turned out he was a welder. So we did some tests and found out that his lead was off the chart. It was like, 50 times the upper limit of normal. And so we started doing chelation treatments on him. And he's now a normal 71-year-old guy. He never had Alzheimer's. He had lead toxicity. Yeah. And so sometimes the whatever works is finding what the real diagnosis or the real cause of the symptoms are.
Right.
That's fun. I love that.
So what percentage of your practice would you say is traditional, where you would prescribe a medication to somebody?
20 or 30%, somewhere, a quarter, roughly.
So what are there different types of medications that you would say they have less side effects or less risk factors, or something that are less harmful or anything like that? Or is
yeah. I think most medications have a purpose. And what happens is you take something like a cholesterol medication that's very useful for a very select small group of people in about 3 to 10% of the population. And the people that market that, though, the marketing company for that drug, wants everybody to buy it. They want it to be available for everyone, because then that makes a bigger market. So they increase their market. And I think that's where the problem comes in. So things like antibiotics, very useful.
Right.
You know, the number one cause of death only 100 years ago is pneumonia. You know, when Mom said, "You're going to catch your death of pneumonia," she was right. You know, that actually happened. Now, I've known a few people that die of pneumonia. It's viral pneumonia, and I've never, I don't know. It's rare that somebody dies of a bacterial pneumonia anymore, unless they have like AIDS or
if they're already weakened.
Yeah,
other
a cancer, or, you know, some other thing like that.
Yeah.
So antibiotics are useful. I have people on antidepressants in some cases. I had one woman, she says, "I want to get off this antidepressant. It's a terrible medication." And then so we tried her we tried to find out why. We did neurotransmitter tests and everything. And we ended up back on the same medication because it kept her stable, and she's living with it, and she's able to function. You know, before the medications were available, people just lived with whatever they had. They had arthritis, they lived with it. If they had depression, they lived with it. Now we have medications useful for some people, as long as it's done properly and appropriately.
Yeah.